Hey, it's Dr. Murphy. Today we're going to talk about chronic kidney disease. So I'll tell you what the role is of the kidneys. I'll tell you how to check your blood work so that you know if your kidneys are normal or not. And lastly, I'll tell you some ways to prevent kidney disease. So we have two kidneys and they're located in the lower back near the love handles. And the job of the kidney is to filter the blood. So we want to get out the toxins and the waste. It also regulates our fluids and our electrolytes or minerals. And it's involved in our bone health and making our red blood cells as well. So it has a lot of different roles. So we want to do everything we can to keep our kidneys as healthy as possible. So whenever you go for your physical, or if you just see your doctor every few months for other conditions, like if you have diabetes or high blood pressure, they usually will be checking blood work pretty regularly because they want to keep an eye on your kidney function. So if you have access to your blood work right now, you can go look for two levels, your creatinine and your eGFR. So those two numbers, if they're abnormal, that could be a sign that your kidneys are not functioning normally. And there's sometimes when you may just be like a little dehydrated or something's going on temporarily where your numbers are off and they'll go back to normal. But if your numbers are abnormal for 3 months or more, that's when we diagnose you with chronic kidney disease. And many people don't know that they have it. And it may be because it's mild, so your doctor may just didn't mention it to you for whatever reason. You don't really have a lot of signs in the early stages, so you wouldn't feel differently. So you really have to look at the blood work to know if your kidneys are normal or not. So whenever you look at the creatinine, normal is 1 or lower. So if it's above a 1, and it can vary a little bit depending on your age, your sex, and your muscle mass. But if it's above 1, then that's something that I would ask your doctor to explain if yours is abnormal or not. And then the eGFR, if it's below 90, that's usually a sign of the kidneys being abnormal.
Hey guys, it's Aiden. Make sure to like and subscribe to the Hey Dr. Murphy channel. Bye bye.
So whenever your GFR is 90 or higher, which is normal, there could be other signs of something being wrong with your kidneys where we still diagnose you with chronic kidney disease, even though that GFR is normal. So there's 5 stages total of chronic kidney disease. So if that GFR is 90 or higher, but there's some other signs of kidney problems, you may have stage 1 chronic kidney disease. Stage 2 is when that GFR is between 60 and 89. Stage 3 is when that GFR is between 30 and 59. Stage 4 is when it's between 15 and 29. And stage 5 is when it's below 15. And that's when we're considering a kidney transplant or dialysis. So whenever I'm working in a hospital, for example, and looking at patients' labs over the past few years, sometimes I find that they have chronic kidney disease and they're not aware of it. Like they're surprised to hear me say it, or they're looking at me with the side eye because they're like, lady, I'm peeing just fine. I don't have chronic kidney disease. But in reality, they do. Many people in the early stages, so stage 1, 2, or early 3, will have no symptoms at all. And when you do get symptoms, it could be very subtle, like fatigue or some swelling. But as you move into stage 4 and 5, those symptoms are more pronounced and you may have other signs as well. And some people actually pee more when their kidneys is failing instead of less. So it's not always easy to recognize. So we want to preserve our kidney function as long as we can. So I'll talk about a few things you can do to help prevent kidney disease. You want to stay well hydrated, making sure you're drinking plenty of fluids every day, preferably water and non-sugary beverages. So most people, if you're pretty healthy and you don't have any health problems where you have to restrict the amount that you're drinking, you should drink probably around 2 to 3 liters per day. But check with your doctor to see exactly how much they recommend you drink. But you want to stay well hydrated. You want to avoid too much sodium or salt in your diet. Typically, we want you below 2 grams or 2,000 milligrams of sodium. So That's adding salt to your food or eating processed foods or canned goods, foods like that have a lot of sodium. You also want to stay away from medications that can be hard on the kidneys, such as over-the-counter ibuprofen and naproxen. If you're taking those for a long period of time, especially at high doses, those can be hard on your kidneys. There's other medicines like some antibiotics, some antivirals, there's other things, and your doctor will adjust your medicines according to your kidney function if needed. But just be aware that there are some over the counter things too that can impact it. You want to make sure that your blood pressure is under very good control and your blood sugar, because diabetes and hypertension are the two top causes of kidney disease or chronic kidney disease. And so keeping those things under great control will help your kidneys. So just keep those things in mind. Definitely stay away from things like alcohol and smoking. Some of those recreational drug uses can impact the kidneys. But those are just a few. I don't want to go over too many, but that's just to give you a general idea of how to keep your kidneys healthy.